mostly maskless and crowded onto a train platform. London commuters go about their day after Britain's Prime Minister removed the mask mandate and social distancing rules, despite all warnings from scientists and some misgivings among the population.
I think that we should still be wearing masks. I've just come up from Brighton, about an hour's train journey, and I was really pleased actually most people on the train were still wearing a mask. But I think it's really premature to be doing lots of things in life like night clubbing and things like that now. I won't be doing that. I think we just need to be a bit more cautious through the summer.
Everyone is going now to be free, but we do have to remember that some things have to stay to keep people safe.
2/3 of British adults are now fully vaccinated. Elsewhere in the world, it is a drastically different picture. Indonesia is suffering through a large outbreak. With skyrocketing COVID-19 rates, hospitals are at breaking point, and health workers are bearing the brunt.
Many of our own medical workers are infected by coronavirus, so we all feel overwhelmed, not only the parademics, but also the non-parademic ones.
Only around 6% of Indonesians are fully vaccinated, and with richer countries buying up the early vaccine stocks, much of Asia has relied on the Chinese Sinovac and Sinopharm jabs. But in recent weeks, concerns have grown about their efficacy, and some, including Indonesia, have announced plans to phase them out. On the African continent, the situation is even more precarious. Only 1% of people there have had 2 doses, and African leaders are pleading with the World Bank for new aid plans to finance their access to and rollouts of vaccines.
Much remains to be done to overcome this crisis, which, as we are seeing these days, is global with several cycles. Indeed, less than 3% of the total population of Africa has received a first dose of the vaccines, compared with about 54% in the US and the EU.
At the start of the pandemic, global supply chain disruptions severely impacted African governments' ability to respond to the crisis. Hundreds of millions of shots from COVAX, the World Health Organization's global vaccine sharing program, have failed to materialize. The low inoculation rate has reinforced calls for a new free trade pact that would improve Africa's access to vaccines.
We have protesters here who've laid out body bags representing the global COVID-19 deaths since a waiver was first proposed at the World Trade Organization that would greatly expand COVID-19 vaccine production all over the world. And the symbolism really here is that delay equals death.
The world's inequalities have been brought into sharp relief by the pandemic, and disparities are becoming ever more visible as richer countries begin to recover. Sara Firth, TRT World.